Does heat help sciatica? In this video, I'll tell you if heat has a role to play in the management of sciatica. Hi, I'm David Fitzgerald, practicing physiotherapist for over 30 years, specialising in managing low back pain. If this is the first time you've seen our video, please subscribe to our channel to get regular video updates on health matters related to physiotherapy. Virtually every day in clinic we'll have patients telling us that their back feels better if it's warm outside, if they've had a hot bath or hot shower, or if they travelled to a warmer climate. It's such a common report that it's hard to believe that people don't genuinely feel benefit from this type of experience. Yet the researchers would tell us that there's no empirical evidence that heat actually helps with these types of conditions. The one common thing we see with patients who describe heat as being beneficial is that they're usually over 50, have a history of recurrent back pain, and often struggle with sustained positions, whether that's sustained bending as in hoovering, sweeping, gardening, prolonged sitting or prolonged standing. So these are the typical findings that we see in somebody who has degenerative changes in the lumbar spine. One of the reasons why those tissues like heat is because of a concept known as viscoelasticity. Now, viscoelasticity just means that the elasticity in the tissues improves as the tissue temperature increases. So we have a situation where older tissues where there is some degenerative change benefit from being heated because they feel more elastic and more mobile, and that generally gives the perception that it's easier to move and there's less restriction of motion. The other factor to bear in mind is that when joints feel a bit stiff and sore, in general the muscles will tend to tense around those joints, and that has the effect of increasing the perception of stiffness. The effect of heat in general is to reduce the tension in muscles, which therefore reduces one of those layers of protective tension around a sensitive joint. So they are some of the reasons I think why heat can be beneficial for simple low back pain. Now, if you have back pain with sciatica, if you're in that older patient population, then you have a slight conflict because the heat may benefit the stiff joints, but if there's sciatic nerve irritation and swelling, the heat only compounds the swelling, because in general heat contributes more to the inflammatory response. So you have a double-edged effect, but in reality the pressure on the sciatic nerve takes precedence over the need to feel the spine feeling more supple. So heat is really not appropriate in that situation. If you're a younger spine and you have acute sciatica, really there is no role for heat. And this can sound a bit counterintuitive, but again, because I've just mentioned the inflammatory reaction is enhanced when you put heat on an area, and that's completely the opposite of what you want to do in an inflamed situation. But the other thing that can feel a bit contradictory is that it usually feels nice to have heat on an area, and again, because heat can reduce muscle tension, it will feel nicer. But in a younger spine with acute sciatica, it really is only compounding the problem, and certainly isn't of any practical long-term benefit. So I hope you found that information beneficial. Please give us a thumbs up on the channel if you enjoyed the video, and if you haven't already subscribed, please do so. As always, feel free to post a comment in this section below and we'll do our best to answer your queries. I'll see you again on another video. Bye for now.